to another episode of the program Service to Humanity, a program that is designed to update you on activities of the Ministry of Humanitarian Affairs, Disaster Management and Social Development. My name is Habiba Zakzok, your host on the program. The Household Upliftment Program, under which the Conditional Cash Transfer Initiative is being implemented, has indeed touched several lives, delivering on its objective of being a major tool for lifting Nigerians out of poverty. In this episode of the program, we will take some stories of Nigerians whose lives have been changed by this program, even as the National Coordinator updates us on efforts to digitize the program. Details of this and more, including highlights of news, when the program continues in a moment.
The entire program is key to helping young Nigerians acquire and develop.
The federal government of Nigeria remains committed to including and protecting persons with disabilities to guarantee that no one is left behind.
I see that we are going through challenging times, and I see this woman running all about the country trying to help our people, because this lady is doing a very good job for our country.
Thank you.
Thank you for all what you have been doing for us.
Service to Humanity starts with news updates from the Minister's office. We will start with the visit of the Turkish ambassador to the office of the Minister, Humanitarian Affairs, Disaster Management and Social Development. This was on Tuesday, the 28th of September, 2021. The visit is to seek collaboration and cooperation between Turkey and Nigeria as it relates to humanitarian response and assistance. While speaking, the ambassador, His Excellency Hidayet Berakat, said the Turkish government has implemented various intervention programs in different countries all over the world and would wish to bring those programs to Nigeria with the support and cooperation of the ministry.
If we can find a way to cooperate or to explore any other things that we can do, because there are, Turkish, we don't have the ministry, but we have institutions like AFAD for, relief, how would you say? Disaster relief, in those areas, especially earthquake, or, in case of, earthquakes or, some disasters that's going on in the world. They are over there, we send them over there, and they do, humanitarian assistance over there.
While responding, the minister commended the Turkish government for its humanitarian interventions for countries facing different disasters. She also pledged the support and the collaboration of the ministry towards partnerships in areas of mitigation and response to disaster.
I think we are in the right place. We hope to work together.
Of course, true.
To have a very effective collaboration and partnership. To see how we can learn from your own experiences. Being a new ministry, but we have agencies under the ministry that have been in existence for the past 30 years.
Okay, all right, okay.
So I think there's a lot that we can do together.
The minister further said the mandate of the ministry was to provide effective coordination of both national and international humanitarian interventions and effective partnerships. She added that the ministry's programs are geared towards alleviating poverty in Nigeria, hence collaboration with the Turkish government will be fruitful. In other news, the Minister of Humanitarian Affairs, Disaster Management and Social Development, Sadia Umar Farouk, has appealed for cooperation and support to effectively address the prevailing humanitarian challenges in the country. She made this appeal at the Chatham House webinar hosted by Dr. Lena Coney Hoffman, where she discussed the social development and humanitarian challenges facing Nigeria and the federal government's response to humanitarian and food crisis in the country. She said the food security challenges in the Northeast is a sore point following the volatile situation in the region, but that the ministry is consistently working with humanitarian stakeholders and the military to facilitate humanitarian access and promote accountability in the humanitarian space within the civil security framework and coordination platform. While explaining that the federal government, through the National Emergency Management Agency, NEMA, provides ration food items to IDPs in the Northeast, state governments and other MDAs also channel food through the ministry or directly to IDPs. The ministry, she said, works closely with humanitarian and development partners to provide food assistance support and ensure it is delivered in a coordinated manner through the Food and Nutrition Working Group. The minister then thanked the United Nations system in Nigeria and various other donor agencies, including development partners, that have significantly assisted in addressing the prevailing humanitarian challenges in Nigeria. Added that the ministry needed more partners to key into existing policies to address the crisis and realize ministry's twin objective of achieving effective coordination and impactful implementation of its programs in a sustainable manner.
My name is Zareti Ibrahim. I'm a beneficiary for Empower Tech FCT. I've been hearing about web designing and stuff, but getting here, I've learned so much. I have learned how to code, HTML, digital marketing. Classes are really going on. I'm eager to learn more, and I'm glad to be one of the beneficiaries.
And it's been a wonderful experience that we've been having with the students. They've been really grabbing. Like, I was so shocked that we are rushing them because we need to get them to get these things in a few months, and a lot of them are catching up. I just want to say a big thank you to the federal government for this wonderful initiative.
You are watching Service to Humanity. More and more Nigerians have begun to accept that this administration truly has the interest of the poorest of the poor in mind when it's designed the National Social Investment Programs. One of its programs, which particularly targets uplifting households from poverty, is the Conditional Cash Transfer. This initiative, which started in 2016, has come a long way in transforming the lives of beneficiaries. We had a recent chat with the new national coordinator of the program, Halima Shehu, as she speaks on the impact of the CCT and more. Let's take details.
The target of the Conditional Cash Transfer Program is to lift at least 2 million Nigerians out of poverty. As a poverty alleviation program, the CCT pays beneficiaries 5,000 naira monthly to, amongst other things, increase the income of families and help them start up businesses from which they can support their families on their way out of poverty. Halima Shehu is the National Coordinator, National Cash Transfer Office. She speaks on the program, why cash payments was an option in the first place, and the process on the recent efforts at digitizing the program.
The aim of the conditional cash transfer is to uplift at least 2 million Nigerians out of poverty, targeting the poorest of the poor and the vulnerable in the rural community. Okay, so the program started as an offline program. What I mean by offline is just that we pay the beneficiaries cash, physical cash, and then we're in a process of migrating from offline payments to online payments. This is because we want our beneficiaries to be financially included in other future interventions that are upcoming around the globe. And as it is now, we have achieved the opening of accounts through licensed payment service providers, commercial banks, microfinance, and money mobile operators. We have achieved about 100% transactional accounts for our beneficiaries, and 30% of our beneficiaries now have access to ATM cards, PIN, USS, and they're kind of in charge of their accounts because they can withdraw at will, they can make transfers, and they can also be able to make payments online.
Halima Shehu speaks on the mandate of the NCTO office, especially as it affects their obligations to the beneficiaries of the cash transfer program.
The mandate of this program is not just about saying we're doing a transfer to the beneficiaries. Because that's why, in the first place, we could easily open accounts for these beneficiaries and just make deposit. It could be done in a day. But then how accessible are these funds to our beneficiaries is the mandate of this program. And at a point, that is why the cash has to be delivered at the doorstep of the beneficiaries, because we know the kind of beneficiaries we're dealing with. They're poorest of the poor, and the civilization has not even reached them. That's the mandate. The mandate is to make sure that they get their cash in hand. So even with this digitization, we're making sure that they have access to their funds. It's not just about opening an account and making deposit in there.
The national coordinator speaks on the impact of the program, which she described as having helped to better the lives of the vulnerable in the society.
The impact has been amazing. From what I have seen, even from 2016 till date, these people have been able to utilize their funds. These are people that never enrolled their children in school. They never had access to maternal health care. They never had any trade. They couldn't even feed themselves. So if you look at the impact analysis now, from where they started in 2016 to where they are in 2021, it's amazing. They're able, in fact, some of them own farmlands now. They do farm, their children go to school, they've been trained on skills acquisition, and they're able to empower even their own family members. And considering that the program targets women, we have 94% caregivers as women. So, you know, whatever you give a woman, you're sure to get double the return.
Halima Shehu is barely 3 months in office as coordinator of the National Cash Transfer Office. How has her experience been?
For me, I wouldn't say the last 3 months hasn't been challenging, but it has also been very interesting. Because when you're dealing with the poorest of the poor, I always tell my team that there are a different kind of beneficiaries. I have worked in the bank. Of course, I have seen all kinds of customers coming in. So with this poorest of the poor, there are people that you need to go down to their level to even make them understand what is going on. And that is one of the biggest challenges, because every area you go to in this part of the country, there are different languages that are being spoken. So you need to go down to their level to make sure they're interpreters, and they have to understand why they are being given this money.
The National Cash Transfer Office and all other programs under the National Social Investment Programs are under the purview of the Federal Ministry of Humanitarian Affairs. Halima Shehu cannot appreciate the Minister Sadia Umar Farouk enough for the support she provides for the program.
She's been very supportive. She's always from one meeting to another with the World Bank, with other stakeholders like the Governors Forum, because in this program, the states have their quotas. So she tries to see that all states have reached their quotas. And because this is part of the government's agenda to uplift 100 million Nigerians out of poverty, it is more of a pet project to her, and she's been very supportive. She's always giving us all the supports that we need.
The National Cash Transfer Office boss calls on Nigerians and indeed other partners to continue to support the program and its objectives for the poor, especially as it concerns mining the National Social Register.
And I will call on every Nigerian that wants to help the poor and the vulnerable to use our National Beneficiary Register. Because with this register, you know exactly who you are giving the intervention to. They're visible, you could see them, and you could see what they're using their funds to do. And I also call on other international donor agencies.
Across the 6 geopolitical zones.
They should use this money for what it is meant for, obviously to take care of their family.
In 36 states and the FCT. over 6.4 million of Nigerians poorest of the poor in about 1.3 million households receive conditional cash transfers of 5,000 naira monthly under the Household Upliftment Program of the federal government. Their joy knows no bound.
And the government very well because they did well for us.
It helped me to do any other thing, my family.
Reducing absolute poverty, promoting shared prosperity through the Conditional Cash Transfer Initiative. The Federal Ministry of Humanitarian Affairs, Disaster Management and Social Development in service to humanity.
Glad to know you're still there. We will continue on the impact of the conditional cash transfer by taking the stories of some beneficiaries in Ogun State, southwest Nigeria. These beneficiaries, mostly women, cannot thank government enough for turning their stories around. Keep watching.
There are currently over 9,000 CCT beneficiaries in Ogun State, spread across the 3 senatorial districts of the state. Femi Ogunbanwo is the State Commissioner for Special Duties and Intergovernmental Affairs and also focal person for the NSIPs in the Gateway State. He speaks on the implementation of the CCT in his state.
Conditional cash transfer took off in 6 local governments, 2 per senatorial district. So for now, we have less than 10,000, but well over about 9,700 people have benefited from the takeoff. But we are hopeful that very soon the thing will spread across the state.
Fagbohun Oluwafunke is the CCT desk officer for Iwekoro local government area, one of the 6 benefiting local government areas in the state. She speaks on the program.
It started last year, October to be precise. We were called to Abeokuta for a training, and after the training we were given a form that we should go to the field to mobilize and sensitize people, and after that we were given a form, it's a list of names that have been shortlisted, and we pasted it, and we told people that they should go and check their names from that list. Those that checked their names, that their names were there, we gathered them again, we talked with them, we told them we are coming for house-to-house capturing. Then after that, we came for house-to-house capturing from each household, and after the capturing, they did this thing for them. What is it? ID card from Abeokuta. All of them, they collected the ID card. Went to Abeokuta, we collected their sheet, cash sheet. So they used that cash sheet to give them their money. So distribution came 29th August, and after that, after a week, it was Sunday. The same week, Thursday, they came for mop-up. For those that are not around when the thing was distributed for them, when it was even disbursed, those that are not around, they came for mop-up, and those that came, they collected their money.
Many of these beneficiaries have already put the money to judicious use, with very encouraging stories to tell.
I used the money to buy Indomie, flour, sugar, and yeast.
Temitope Oshineye, a resident of Ikenne town in Ikenne local government area of Ogun State, is a 33-year-old mother of 3. She is a petty trader who has been without her husband for a couple of years now. She sells noodles and snacks for a living. She is one of the beneficiaries of the CCT program in the state.
They give us 10,000 naira.
So what did you use it for?
I use it to buy Indomie with pawpaw. The gain that I get from that money, that's the money I use to feed my children. That program is good for us, because we thank them. If they did not give us money, we cannot use the money to buy anything like this.
Mama Olaide Olutayo is in her 80s. She's also a beneficiary of the conditional cash transfer. She lives in Ikenne town of Ikenne local government area of Ogun State.
They called us to come, that the federal government will give us stipends. And so we went. I used the money to buy kerosene and oil.
A petty trader, she explains how she utilized the 10,000 naira that she got through the program.
I benefited a lot from it because if the money had not come, I would not have had additional capital to increase my business. When I collected the money, I gave my children some. Then I added the balance to my business. It's a very good initiative. What they have done for us has not been done by previous governments.
Daibat Akindele is a 43-year-old mother of 5. She sells food as well as other petty items. She narrated how she put the money she got from the CCT program to use.
I added the money to my business. As we make profit, we use it to take care of our children. We use it to pay their fees. These are benefits from the scheme. This initiative is very good. It should not be stopped. Let's keep enjoying the benefits. God will help them to continue.
Oyeyiga is a mother of 5 who sells banana and plantain for a living. She is one of the beneficiaries of the CCT program in Ikenne local government area of Ogun State.
When I collected the money last month, I took the money to the market and bought bananas and started selling and making profit. We thank the federal government for this initiative because it has helped a lot of us that received this money from government.
Abosede Shoyebo, another beneficiary from Ikenne local government area of Ogun State, speaks on the numerous benefits of the money she got from the CCT program.
When they called us, we went there and we were given this money. When we collected the money, we added it to our businesses and our profits increased. As God will have it, schools resumed. We saw the gain of this initiative because it was from our profits. We bought school items for our children. No child was left at home.
Abosede Salami is a widow with 2 children and a petty trader. She resides in Wasimi community of Iwekoro local government area of Ogun State. As one of the beneficiaries of the CCT in the state, she speaks on the impact of the program on her business and family.
This is a very good initiative. I have never seen the like of it since I was born. In fact, the money is of great benefit because as soon as I got it, I was very happy. I took it to the market and stocked my shop. I bought all the items I didn't have in the shop and added. It has been of great benefit because I have been widowed for quite some time now. I have been taking care of my children since then. So when I got the money, I added it to my business and I'm making profit from it. My children and I are eating from it. So I'm very happy about it.
Elizabeth Kashimao is also a resident of Wasimi community in Iwekoro local government area of Ogun State. She makes and sells gari for a living. She described how she felt on the day she received the CCT transfer.
It was from the money we received that I bought cassava to start my business. I really benefited from it and my children benefited from it because we bought food from it and I bought cassava from it to make gari that I sell. And we eat from it. Government really did well. God will bless them.
With the stories of these women, we end this edition of Service to Humanity. Join me again same time next week and on this same medium for more on the activities of the Ministry of Humanitarian Affairs, Disaster Management and Social Development. Until then, have a great week ahead and stay safe.